Good evening. I'm speaking to you from Historic Government House in Edmonton. This is the building and this is the room where your MLAs discuss your concerns and put our unfinished business on the public agenda. And that's what I want to discuss with you this evening, our unfinished business. This is the third time that I have addressed you on province-wide television. In January of 1994, I talked about the urgency of the fiscal crisis we faced, the debt and deficit monster that was threatening both our present prospects and our future prosperity. And I discussed with you some of the difficult measures that would be necessary to confront that crisis. You had told my colleagues and me and government to do what had to be done to get our spending under control. And we responded by determining that, in a crisis, the most daring course of action is often the most successful. So we set out on a daring course, a course to cut spending and to hold the line on taxes, but still deliver the quality programs and services Albertans need. It was a tough course of action, I know, and this evening I want to thank you for your help. In January of last year, I gave you an update of our progress on that course, with particular emphasis on health care, education, and our seniors programs. Well, this evening I want to update you once again on where we are on our plan and what we can expect in 1996. Let me start with the fiscal plan, because we had agreed that we had to get the dollars and cents issues right if we were to preserve a strong Alberta. This is a graph of the fiscal plan we presented in the spring of 1993, the plan that would get us a deficit-free Alberta by the spring of 1997. They were ambitious targets, daring targets, but with your support and advice, we were confident that we would get there on schedule. Now you can see what we have actually accomplished together. We are obviously well ahead of schedule. Indeed, instead of the $500 million deficit we predicted 2 years ago, we are likely to see a surplus of about $570 million this year. Now, some will say that this is solely because of increased revenues, but that does not tell the whole story. The story of the men and women in the public service who took wage cuts and who still look for savings every day. The story of a province that has held the line on spending, just as you told us to do. Our spending is 21% lower than when we took office in December of 1992. The story of a province that continues to search for ways to eliminate waste and duplication as a daily priority. And the story of a province that can absorb cuts from federal transfer payments because of our sound financial planning. So yes, higher than anticipated revenues have helped. But remember, both you and the financial experts told us to use honest estimates. In the words of the 1993 Financial Review Commission, budget estimates for revenues and expenditures should be based on realistic and conservative assumptions. And that's what we have done. Using realistic revenue projections and maintaining a firm hand on the government checkbook have both played an equal part in our success. And yes, our fiscal plan is ahead of schedule. Now, some people say, spend more, give us back some programs. And some people say, save more, just pay down the debt. And some people say, reduce taxes. Well, I will have more to say about your priorities, which are indeed the government's priorities, in a few minutes. But first, let me move to the issue of health care. We determined in the spring of 1993 that our health care costs were out of control, and in order to save our health care system, we had to restructure it. And we have accomplished much in the past 2.5 years. First and foremost, we have removed unacceptable overlap and duplication. In 1992, we had almost 200 separate health care boards with separate administrations. Well, today we have 17 regional health authorities who manage our hospitals, health units, nursing homes, and community services. We recognize that there is no one-size-fits-all health solution because each community is different. So we turned to the people in the communities and gave them the authority to provide you with the health care you need. With that local decision-making process in place, our role now is to fund the system and to monitor the quality. And with those changes, perhaps the biggest improvement over the past 2.5 years has been the shift away from long and expensive hospital stays to more home and community services and health promotion. In home care alone, funding has dramatically increased since 1992. But while much has been done, there are still many things left to do as we focus on guaranteed access and on the highest quality of medical care. In 1996, what may surprise you the most is what won't change. Your family doctor will still be your first point of contact for many kinds of services, and emergency wards will still be there to serve you as they did before. What will improve is your access and your choice to all parts of the healthcare system. Now, one call to your regional health authority gets you on the right road to the services you need. Different kinds of services, from home care, hospital care, to nursing homes. These are all part of the network of your regional health authority. Those regional health authorities are working hard to provide you with the information you need about getting services, such as the Lakeland Regional Health Authority in northeastern Alberta, who have developed this brochure that explains in clear, helpful language how to access medical services in their region. And other health authorities are looking at similar ways to improve your access to the health system when you need it. Ladies and gentlemen, we want 1996 to be a year of assessment and evaluation of the system. And that is why we acted in November to cancel the last round of cuts to your regional health authorities. That decision means that regional health authorities will now have $93 million more than they had expected to better implement their changes. And your regional health authorities will continue to develop new programs to meet the needs of Albertans, such as the landmark Alzheimer's program in Edmonton, where patients live in a comfortable home-like setting while receiving round-the-clock medical care. The Northern Lakes Project, an innovative network of health services meeting the needs of Albertans in remote northern communities. The Children's Assessment Rehabilitation and Education Center in Lethbridge, where children get the care they need with their families close by. And in 1996, we will be implementing our new agreement with Alberta doctors, working with them and other professionals to achieve our healthcare goals of access and quality. For example, in science and research, especially in the healthcare industry, that means investing in the future of our province. Because when you need healthcare, you want the right service from the right healthcare professional at the right place. Ladies and gentlemen, all of these initiatives are designed to monitor and fine-tune your healthcare system to keep it contemporary, responsive, and affordable. That is our goal, not just for 1996, but beyond. We are building a first-class healthcare system that will not only be there when you need it, but when the next generation needs it. We accepted the tough task of restructuring our healthcare system, not just to keep it contemporary today, but to guarantee its quality tomorrow. It has been hard, it has been controversial, but I can tell you this evening, it is working, and it was the right thing to do. 1996 will have other challenges for Albertans, for you and for me. We need to make sure that the changes we have made to our education system achieve our goal of sending the best prepared kids we possibly can into the global workforce. An education system where good enough is not good enough. We want to ensure that the justice system we have developed will produce the safe streets and secure communities that you deserve. And we want to make sure that our programs for seniors meet their needs and respect their independence. We want to maintain the tough environmental standards that we have in place to protect Alberta in all her majesty. And we want to ensure that our social service programs are fair, that those who need help will get that assistance, but that there are no more free rides. In all of these areas over the past 2 years, progress is being made. So, what can we expect in 1996? Just as in healthcare, it will be a year of transition and monitoring. The year we make the transition from the abrupt but necessary changes of the past 2 years to the new systems we have put in place. It will also be the year we monitor each and every change we have made to ensure that Albertans are still getting quality services and programs at a price we can all afford. That is the task in 1996, to continue to budget conservatively and to attack our debt, but also to maintain a parallel track to evaluate and monitor our progress. I believe Albertans want both of those things to happen. And so now let me return to those two groups of people who look at a surplus, and some of those people say spend more, and some say save more. The answer, I think, will be a balance. Next month, the provincial treasurer will present a budget that will eliminate our deficit forever, and we will meet our debt repayment obligations as required by law, a law we passed. On the other hand, if our monitoring of changes indicates that we need to target your tax dollars to get better results, then a surplus will allow us to meet that challenge. And we will examine tax relief. We will not throw money at problems, but we will invest in programs and services that produce quality results. I can give you a few examples this evening. To meet people's desire for a quality kindergarten program, funding for early childhood services will be restored to accommodate a 400-hour program instead of the existing 240 hours. This year, the government will provide an additional $11.4 million in new funding to clear the backlog of people waiting for things like joint replacements and some types of heart surgery. In 1996, each Alberta school will have a computer hooked up to the internet, so students can talk to the world right from their classrooms. In 1996, we will commit $6.3 million to continue twinning the North-South Trade Highway so that Albertans' products can move more efficiently to markets. Those are the kinds of things that the dividends of our hard work should be spent on, at the same time as we keep up our attack on the debt. And let's not forget, ladies and gentlemen, that in doing all of these things, we are building on the Alberta advantage. And that is something far more than a cliche. It is the goal. Deficit elimination was the short-term goal, but the long-term goal has always been a better Alberta with quality jobs, employment opportunities for today's workforce and for our children, the Alberta workers of tomorrow. You know, when we talk about the Alberta advantage, we are talking about the real and tangible reasons that companies and industries want to do business in Alberta, as opposed to any other place in North America. What is the Alberta advantage? Well, it is the lowest overall tax rates in Canada and no sales tax, an educated, productive workforce, abundant natural resources, a modern and efficient infrastructure, a first-class transportation system linking air, road, and rail, a clean environment, a strong science and technology culture, and that is why these and other companies have recently chosen to relocate or expand in Alberta and provide jobs for Albertans, because it is the best place to do business. With their investments, these companies bring real estate activity, consumer spending, meaningful jobs, and direct financial benefits to all Albertans. Is the Alberta advantage working for you? Well, on April 22nd, 1993, I stood in the Legislative Assembly and announced a new economic development strategy for Alberta. It was entitled Seizing Opportunity. As part of that strategy, we set a job creation goal of 110,000 new jobs by the end of 1996. We also said the private sector should create those jobs and not the government. I am pleased to report to you this evening that from December of 1992 to December of 1995, employment in Alberta grew by a total of 103,000. Of those new jobs, 95% were in the private sector. 70% were full-time jobs, and our youth unemployment rate is the lowest in the country. Yes, our strategy is working, and we will continue to promote and refine and fine-tune the Alberta Advantage because it means jobs for Albertans and future jobs for our children. As we all know, Alberta is just one province in a great but uncertain nation. In discussing the upcoming events for 1996, I must make reference to the issue of Canada's future. It is not an issue that Albertans necessarily want to embrace, but I fear the issue may soon embrace us. And we can neither escape Canada's past nor avoid Alberta's future. I believe Albertans don't want to become involved in constitutional wrangling once again. Our hesitation in going back to the constitutional table is real, yet it is balanced by our love of country. We may have to return to the table in order to help to save the House. If that is the case, I can only tell you where I will stand in any constitutional discussions. First, negotiations must be as open and as transparent as possible. The future of this country should be debated in a way that Canadians can see and hear and be heard. Second, our goal must be a strong Alberta in a strong and united Canada. And third, there must be constitutional equality amongst the provinces. With those guiding principles, I believe we can bring about the renewal of our country, the renewal that Canadians want, the renewal of a country worth keeping. Alberta has both much to say and much to offer as the future of our country is debated. And we want to share in responsibilities and rewards that come with being Canadian. Those are the principles that will guide us as we define and build a better Canada. So, my friends, that is the Alberta agenda for 1996. First and foremost, to continue with our plan of fiscal responsibility, balanced budgets, and debt repayment. Second, to monitor the changes we have made and ensure that there is a smooth transition to the kind of public sector programs Albertans want. Third, to invest only in areas where we will see an increase in the quality of the program or service, such as a better prepared child, a healthier senior, a more self-reliant Albertan, a safer highway. Fourth, to continue to promote the kinds of policies that attract business to Alberta, that bring jobs for our citizens. Fifth, to maintain a strong Alberta in a strong and united Canada. And finally, to continue to listen to Albertans, the people who truly set the agenda. Ladies and gentlemen, those are the things I see when I look ahead at 1996. I cannot predict the future, but I know the past. And I think I know the Alberta people. And it's not the Alberta people who rely on me, but quite the opposite. I rely on you. And as we meet all of the challenges I have discussed with you this evening, my colleagues and I in government will continue to rely on you, because the partnership between a government and a people will only last as long as we work together and listen together. That is why we need to hear from you tonight and in the days ahead. We need to hear from you about issues like healthcare, education, how best to reinvest in the new Alberta. And we need to hear from you because it is your money, it is your province, and it is your future. Thank you, and good night.